Hello, I want to use this opportunity to say thank you all. Thank you for the love you show to me. Thank you for all the engagements. Thank you for all the stars, all the hearts, all the love. Thank you for supporting my YouTube channel and my Facebook page. I am so grateful. Thank you. And we're going to go into today's presentation, today's topic. Today we will be talking about wound. We'll be talking about what kind of wounds do we have, what causes a wound. We can be talking about wounds in the lower extremities, especially the leg. We're talking about the difference why wound in the legs heal slower than wounds in other parts of the body. We'll be talking about that and also why wounds can be treated in certain ways. We'll be talking about this, especially for those people who don't really know much about wound, because a lot of people in different parts of the world still believe that wound can be caused by someone or something evil. Someone may have done something, in that sense. It's important that we equip ourselves knowledge wise, so that we will be able to understand better and make a right decision on time to heal our wounds faster. So, what is a wound? I will read. According to the NHS, wound is a break in the skin or other body tissues. This can be caused by various factors like cuts, scrapes, punctures, or even surgical procedures. Minor wounds can usually heal on their own, or more serious wounds may require medical treatment. Yes, if we have a wound, say in any part of our bodies, it is expected that this wound should start healing between 2, 3, 4 to 5 days, 1 week to 2 weeks. And this, if it doesn't heal within these 2 weeks, then that wound can be regarded as chronic wound. And if it is in the legs, it can be regarded as, can turn to leg ulcer. It can turn to leg ulcer. And this is where most people will say, oh, something has happened, this has happened, something may have happened, or someone may have done something strange to the person. It's important that we understand that the causes of these wounds might differ, and healing might also differ, and we don't catch it on time, it can escalate, and escalation can result into different type of things. Say for instance, wounds, we're going to be talking about causes of which, whatever may have caused the wound. If the person is diabetic, the wound can go worse, or the wound can take too long, than usual to heal. So it's important that we catch it on time, understand the etiology behind the wound, and what we can do to, improve healing and speed up the healing process. So, talking about types of wound, we have open wounds and we have closed wounds. Open wounds could be cuts, it could be punctures, it could be anything, name it. So, whatever it is that has opened the skin, the epidermis, probably the dermis, and the other under layers of the skin, may be seen as open wounds. Other type of wounds could be closed wounds. Closed wounds could be maybe bruise. Something hit someone somewhere in the leg, in the arm, wherever, and the under layers of the skin, has been damaged, but the top layer is still intact. So that can be seen as closed wounds. So this can also around it show swelling, it can show redness and all that kind of thing. This is also part of the healing process. So when we understand this, then we will know which area or which approach to take to help in wound healing. So it's important also that we know when to seek for medical help. If our wound is not healing, seek for medical help. If you have a healthcare provider, show them, tell them that you have a wound and this is how it has become. This is when it happened, because time is very important in wound, history and wound care. It is important to monitor the wound when it happened, to know whether it is progressing, healing wise, or is it getting worse. So how do you do that? You can take a photo, you can measure your wound, measure the length, the width, the depth, and see, is this wound. This will help to monitor the wound progress. Sorry, the wound healing process. So wound in different parts of the body, as I said before, can heal, differently. It can heal. Some of them can heal faster and some can heal slower, and some may continue to persist due to different factors. One of the factors that can improve wound healing is age. Younger people, definitely they heal faster than older or elderly people, right? Our diets also play a huge role in the healing process. In some of my other videos, I talk about classes of food, of which protein is one of them. Do you take enough of your proteins, your chicken, your lentils, your beans? Do you take them? Remember what proteins does in the body. What does it do? It repairs worn out tissues. It helps in the healing process. So take your proteins serious. Lest I forget, you must tell your healthcare professional if you have a deep or large wound. If it is a bite from human being or dog or even cat or whatever animal it is, it's important you let them know. Is your wound showing any signs of infection? If you're a healthcare professional, you will know what signs of infections are. And if you don't, if you're not a healthcare professional and you want to know, or you have a wound, signs of infection include redness, pain, swelling, and on top of the wound, say it's an open wound, you might start having like greenish, yellowish kind of concern. When you look at the wound bed, you might say, oh, this wound is getting infected. So it's important that you assess your wound daily from time to time. And also, if your wound is not healing at all, irrespective of all treatments, you've been having treatment, you've been having leg dressings, you've been taking antibiotics, and the wound is still not healing, it's also a time to escalate, a time to review what has been happening and what you're doing and what you need to do, to still be on top of the game. So let us focus on wounds on the leg and other parts of the body. Why is the healing process different? You can see that the lower leg, yes, let me say wound in the lower legs, because I've said wounds in the leg. Let's focus on the wounds on the lower legs. Wounds on the lower legs is part of the extremis of the body that is farthest from the heart. And because it is the farthest from the heart, it takes longer time for the heart to pump blood to those extremities. So what do? It makes the treatment for the lower leg ulcers different from other parts of the body, of which if someone has a wound in the neck, they're not going to be bandaged. But on the legs, yes, it can be bandaged. The importance of bandaging or different kinds of bandages, we're not going to go into that today, but the importance of whatever wraps, bandage, whatever it is on the leg you have, is to improve or increase circulation. Why is circulation important in healing of wounds on the lower legs? We know that our bloods, has red blood cell in it. Red blood cells in the blood, we have hemoglobin in the red blood cells. the hemoglobin carries oxygen. And you know that oxygen is in the blood, helps, in healing processes as well. So when your heart pumps the blood to these areas and they receive oxygen, without oxygen, say for instance, you're not getting oxygen, or someone is, their oxygen level is going low, they will start having blue lips. That means life is leaving the person. So that means oxygen needs to be increased. Oxygen is what keeps the tissues alive and keeps them, healthy. So if your heart is not able to pump the blood to these extremities, these legs, or wherever it is not healing, then the healing is going to be slowed down. So this oxygen in the hemoglobin, or the hemoglobin carrying oxygen in the red blood cells, taking it to those wound sites will improve healing. So this is the reason where it is as if the wounds in the lower legs heal slower than any other parts of the body. And I think the first thing we recommend in such cases, after 2 weeks is not healing, I think the gold advice could be to try bandaging, because bandaging is a gold standard. Making sure you bandage the right way, that you've received the right training and you're able to do it and leave your patient comfortable. So the next part of this video will be bringing you, probably will be looking at pressure ulcers. Pressure ulcers, very, very, very important, especially for people who are immobile, or people who have reduced mobility, people, with different or higher risk factors of developing pressure ulcers. A lot of us do not understand, especially in different countries whereby there's no free healthcare, whereby the awareness is not as it is supposed to be. So it's important that we look out for these videos that will be coming up, very soon, so that we will pick up 1 or 2 points and be able to cater or care for our loved ones, and give them the best that we can. Why not, if you can? Why not? We all want our loved ones, to be healthy. We want them to get the best. So pay attention and look out for this video as we bring you more vibes. I hope you have enjoyed the day. You like the video. Please, if you do, give it a thumbs up, like, share, and subscribe. And I'll see you again in the next one. Thank you for watching. Ciao, ciao.